Telehealth is the next best thing to being there. Hi, I'm Margaret Martin, registered physical therapist, educator, and author based in Ottawa. I've practiced in a wide variety of both clinical and hospital settings over the past 37 years. Over the past several years, I've had the opportunity of bringing telehealth into my practice to be able to reach clients, whether it was convenience or distance, that made it impossible for them to come in. Technology today allows us to connect like never before. Much of what I do in a clinic, I can do now through a screen. Those of us who practice telehealth know that it takes an experienced eye to be able to work through somebody through the screen, to be able to assess not just their movements, but also their level of confidence. Some of my clients are unsure what to expect when it comes to a telehealth session. And so I want to share today some of the sessions that I have had with clients over the week. So one interesting opportunity was the ability just to help a young man who was recovering from a wrist sprain. He's a big rock climber, and so just ensuring that he had full range of motion and that he was going to then be able to take that restricted range and work through it before he started tackling his climbing again. With another client, even though he wasn't quite ready for aggressive rehabilitation, because he had had such a serious sprain, he wasn't weight bearing at all. And so I got to watch him, using his crutches, managing both how he was walking and how he was managing the stairs, and to be able to give him some strategies to be able to move him to the next stage. With another young individual, it was working through the final stages of shoulder rehabilitation. We had regained range of motion, so just ensuring that we were at that stage to then progress to starting a strength program. For another individual that I hadn't seen in quite some time, watching them perform their steps allowed me to realize and help them realize that weakness in their hip was leading to a compensatory pattern in their knee, where their knee was caving in as they were going upstairs, putting more stress on the knee. And that was a great example, I think, of being able to just identify that weakness that they had they continued, would have led to a knee problem. Our bodies are made to move. And so whether you had a relatively minor injury, like a sprained ankle, or a more severe injury, like a fractured hip, if you don't get your rehabilitation at the right time, you're probably going to end up developing a compensatory pattern. If there's one thing that I've learned in the 37 years of experience, is that compensatory movements are more frustrating to break down for both the clinician and for the patient, because you've now patterned that movement over weeks and sometimes months and sometimes years. And so now you're having to undo the pattern that you created. And not only does it take more time therapeutically, but it takes more money. So I encourage you, if you have any pain or any joint restriction, if you're not moving the way you want to be moving, and if you're not achieving your goals, of enjoying life and being able to do the movements that you love to do because of pain or discomfort, then I strongly encourage you not to wait until the clinic is open, or you can get someone to drive you, or you have enough time in your life. The use of telehealth saves you commuting time. It saves you asking neighbors for a lift. Today's technology allows me to work with you in the privacy of your home to provide you with a progressive, safe program using whatever tools that you have at your disposal. When I contact my clients and, due to circumstances, will suggest to them that they, should consider changing their studio appointment to a telehealth appointment, some of them are quite hesitant. And they're not sure how effective the session's going to be, and others are reluctant because of the use of technology. But what I've noticed is once they've had that first telehealth session, all that reluctancy, all that hesitation is cast aside. Most of them are very appreciative at the convenience and quite surprised on how productive our sessions are. So I want you to know that once you've booked your appointment, that one of our staff will contact you to ensure that you are comfortable with everything you need to be ready for our session. They'll walk you through the technology that we use and ensure that you're comfortable with setting up, so that when you and I meet, we don't waste any time and we're ready to start our session together. To book a session, simply click on the button below. If you're new to the clinic, or if you have a new problem that needs to be addressed, then please book an assessment. Otherwise, if you're returning, you can simply choose between a 30, 45, and 60-minute session, whichever you feel is going to be sufficient for you. So remember, telehealth is the next best thing to being there.